Good morning and welcome to Global Healthcast 31. Today is March 29, 2023. I'm happy to present this to you today. And I am Joe Schmitt, and with me is Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good afternoon or good evening to those who are watching us, depending on where you are at the moment.
The topics we are covering today is, as always, the COVID-19 update, the influenza update, World Tuberculosis Day, and then I have a couple of small items on acute effects of caffeine consumption, persistence of yellow fever neutralizing antibodies, safety of mRNA vaccines, ARI-pathogens in wastewater, and finally we have a new item here which is called fake products, Zeckifor prevention of ticks. Melvin, what is the update on COVID?
Yes, thank you, Professor Schmidt. So for those of you who have been watching us for the past 30 episodes, you already know that we start with this quick global COVID update from the WHO. Globally, over 3.7 new cases and over 26,000 deaths were reported in the last 28 days. This is actually a decrease of 31 and 46% respectively compared to the previous 28 days. And if you see here, you will look at the figure, you will see that besides the increase in cases and deaths in November and December because of China mainly, the cases and deaths are going down. And if you move to the next slide, here you will see the number of cases at the country level. And the highest number of new 28-day cases were reported from the US, from Russia, from China, from Japan, and from Germany. And again, these are just cases, right? So you look at the map and you will see there are other countries that are showing red there, but this is because the cases are increasing, but it doesn't mean that they're part of the top 5.
So overall good news. The question then is, how is it with the deaths?
Yes. So in the next slide, you will see that the number of deaths actually, if you just look at this visually, right, you will see that the colors are not as bad as the number of cases in terms of the increase. The highest number of the new 28-day deaths were reported again in the US, in the UK, in Japan, but this time Brazil is actually included in the top 5, even though Brazil was not in the top 5 in terms of cases.
Interesting. Yeah. There are more ARI-pathogens, and these ARI always are on our agenda because they are the most common diseases of mankind. So I guess the other topic then would be where are we with influenza this year?
Yes, so this is also from the WHO, and this is not as updated as the COVID situation report, but here you will find that the activity of flu continues to decline, though levels in parts of Europe are still above the epidemic threshold, and there is a little spike in China. And in Europe, actually, half of the countries are still reporting widespread activity. In the US and in North America, flu has declined to levels normally seen at this point of the season, so nothing really special there. And in East Asia, flu increased in China mainly due to the 2009 H1N1 virus, though other countries in the region reported declines in flu activity. And on the next slide, if we go there now, you will see that these are the flu specimens submitted. So they were actually tested to check whether you had flu A or flu B and subtype, what kind of flu A or flu B, right? And on top, you will see that for North America, it's mainly just influenza A. Almost everything, actually everything was influenza A. And if you look at the figure below, that's in Europe, initially it was mostly A and a little bit of B. And then at the after December, January season, then we saw a lot more influenza Bs, which was interesting, right? If you compare it to the US, where you really didn't see any influenza B.
Yeah. It is also interesting that the US had their influenza epidemic before we saw it in Europe.
Mhm.
I thought this largely goes parallel, but interesting that it is that there is a little delay.
Yeah, several weeks ahead. And
Yeah.
this is Southeast Asia, which is, I think, obviously, right? We see it's very different from the first two images we saw. And here, this is mainly driven by Malaysia, Thailand, Singapore reporting influenza B predominantly, H3N2 predominating in Singapore and Thailand, and very few detections of influenza A H1N1 pandemic zero 09 virus reported in the Philippines. And that is very different from what we've seen in the previous slide.
So they also have influenza B right now. And I remember from Germany, we saw an increase in B cases lately. There were not too many, but we saw some percentage of B cases there. Interesting. Yeah. So, I mean, it is funny how diverse the epidemiology of influenza can be looking in different geographies. And that is something I never understood. Why is this, right? And why is it delayed here? Planes are traveling influenza anywhere, right? I mean, people go over continents within a short period of time and they bring the pathogen to the different areas. So why is it that there is such a diversity in the epidemics? But it is what we is. We can only describe and have try to find explanations later. We have another topic, and the topic is TBE.
Tuberculosis, TB, yes. Um, so for this one, I just wanted to show this because last week, March 24, was World TB Day, right? It is one huge celebration or a reminder for everyone that TB is still a big problem, a huge global public health problem. And to remind everyone that, before COVID, TB was actually the biggest infectious disease killer in the world. And now that the cases of COVID are going down, I would imagine that in the next few years, tuberculosis will again be the number one case, infectious disease killer, right? And this is just showing us a report from the ECDC, the European CDC. TB notifications have gone down significantly if you compare it from the 1990s, which is a good thing. And we are also seeing a downward trend in TB mortality, which is also a good thing, right? And the cases of TB are different depending on the countries, but mostly they are in the eastern part of Europe.
Very interesting. And I remember from the early 1990s that we had a lot of Russians who moved back to Germany after they had gone, or their families, their ancestors had moved to Russian speaking countries some 100 years ago. They returned, they were allowed to return to Germany. And there we saw an increase in tuberculosis cases after a while. But then numbers went down again because if there is good case finding, numbers of and treatment, numbers of cases are continuing to decline, and the epidemic will be very much reduced. The question then is, I guess we really have to make sure that there is a good public health status all over the world so that TBE will continue to decline. Or what is your view here?
Yeah, I mean, as long as TB is a huge problem in a part of the world, then the rest of the world is at risk, right? Because of globalization, we travel a lot now, and we can't be isolated from the rest of the world, right?
Yeah, very interesting. You have TB in Africa as well, and what
Yes,
is the
so
situation there?
this is from a press release that was sent out last week during the World TB Day, and basically saying that Africa is doing well actually with a yearly decline of 4% in tuberculosis cases, which shows that there is progress. Also declines in terms of death, but admittedly, because of the COVID pandemic, many of the services of TB screening, TB treatment, and all these things, they were really affected by the COVID pandemic, right? And we are now in the third year of this pandemic, so we are expecting these good numbers to change in probably next year, but this is also a call by WHO, especially the WHO African region, for efforts to be doubled to make sure that the progress that we are seeing here will not go to waste.
So much more needs to be done. And COVID interrupted tuberculosis services, and this has to be reinstalled. And people have to make sure in Africa that this will work again. But they were quite effective. I'm impressed by 4% reduction rate and 75% death toll reduction. This is really some very good news.
Yeah.
Thanks for sharing. And I guess I have some information now that has nothing to do with infectious diseases, but with my own well-being. I'm a coffee lover, and I drink half a liter to a liter of coffee every day. And I certainly did check the literature if there is any adverse event. And very frankly, people have been searching for adverse events of coffee drinking, cancer, pancreatic cancer, and I don't know what. They found nothing to date. And now, this is a very small study with 100 healthy young adults, and they were animated to drink coffee or to avoid coffee. And the main outcome was really premature atrial contraction, because it is well known that a greater frequency of premature atrial contractions predicts new onset of atrial fibrillation, at least in older people. And so I was very worried when I saw the study. In the end, the study is non-conclusive, but I'm a little bit more relaxed now. You see, there was no effect on premature atrial contraction. There may be an effect with regard to premature ventricular contraction. There are a little bit more in the coffee consumption group. You sleep less if you drink coffee, which is nice. You can work more, right? Or you can have more fun if you sleep less. And you are more active. You walk more steps as compared to people who avoid coffee drinking. In the end, what does it boil down to? I'm not sure. This was a New England Journal of Medicine study, and for me, it is inconclusive. The trial was small. It was not blinded. There may be confounded. It was a young, healthy population, and I'm 60 plus. I'm not sure what the conclusion is. My conclusion is I will reduce my coffee drinking a little bit to a cup or 2 cups in the morning and maybe 1 cup after lunch, and then I will stop. I mean, in the end, the dosage makes the poison, right? If you drink a lot, you may have more effects or side effects. And if you drink less, it probably you will be better off. So this is for my own conclusion only. And thanks for listening to my own subject, which has nothing to do with infectious diseases. Melvin, any point from your side?
No, I think that the dose thing is very important, because for me, I only drink 2 cups a day, but I make it really concentrated. So maybe my 2 cups a day is equivalent to your 4 cups a day.
Yeah, very nice. I have another topic on duration of neutralization titers following yellow fever vaccination. As you well know, if you travel to a yellow fever endemic area, you have to show at entry into the country your vaccination passport with documentation of yellow fever vaccination. Now, the big question is, how long does protection last? And the countries that you travel to, they will require that you get another dose every 10 years. There is quite a lot of information by now to show that there is protection that lasts longer than the 10 years. Some people even say this is a life vaccine and very likely you're protected for life. This is a study where they looked into military personnel, actually 322 subjects. After vaccination, they had neutralizing antibodies from vaccination to evaluation. It was from less than 1 year to up to 47 years. And most subjects did show up with neutralizing titers. And if you were just vaccinated, you had higher titers. If vaccination had happened some decades ago, titers were on average lower. The main message is even after 47 years, neutralizing antibodies were present in the few subjects with that long follow-up. It is inconclusive again, but it's a little other piece in the puzzle just to show you're well off if you have received yellow fever vaccines. You're probably, or you may be protected for life, nobody knows. But more and more evidence is emerging to suggest that there is lifelong protection after yellow fever vaccination. In reality, legally, you will have to come up with a 10-year booster or second dose. It's not a real booster, but with a 10-year second dose if you travel to endemic countries. Melvin, you're a frequent traveler. Any views on this?
So my first yellow fever vaccine was in 2012. That was the first time I went to Africa. And I remember I really felt sick right after getting the vaccine. Like I had to go home and sleep, and I had fever, which was really worse than what I experienced with the Pfizer COVID vaccine, and I think because of the study, it means that I might not need the booster the next time I go to Africa.
Yeah. Actually, I think in young people like you, it would not damage you very much. But the older you are, the more likely you may get liver failure. And that is certainly serious if you're a healthy older person and then you're sick following vaccination. So think about what needs to be done and think of your travel. And we now go on to the safety of mRNA vaccines. You may well remember early on in the pandemic, people were very much concerned about the safety of these newly introduced mRNA vaccines. They were the only vaccines around because they are rapid to be produced, and all other platforms for production, subunit or whole cell, whatever, they take much longer for mass production to have sufficient amounts of vaccine available in a short period of time. It is simply not possible. So mRNA vaccines were the vaccine of choice at the time, but everybody was concerned about rare side effects. And here we have now data from the United States, post-marketing data. And remember, the United States population is some 300 million. And from that population, 58,000 reports were received, 439 of them marked by the market leader or for the market leader, the Pfizer-BioNTech vaccine, and 300,000 of the Moderna vaccines. And there was nothing new. There was no new finding. Every adverse event that was reported had been observed before. Now, in this study, a disproportionately higher frequency of myocarditis, Bell's palsy, and anaphylactic shock was found with the Pfizer vaccine. This was an observational study, so there may be confounders, there are confounders, and causality is difficult to assess, but in the end, the conclusion of the authors is that even if some rare adverse events were identified, and they had been known before, our survey of post-marketing surveillance has provided further evidence of the favorable safety profile of mRNA vaccines. Melvin, any comments on this and the history of side effects of mRNA vaccines?
Oh, I think it's another good piece of reassuring piece for us, right? To tell us that this is actually a safe vaccine. And with all the garbage that's out there on social media and fake news about safety of mRNAs, this is a good paper to counter that, I think.
Yeah, I agree. I'm really happy with this. And again, there is nothing unusual that had not been observed in the smaller trials as well. So good news. And this is another interesting thing for future pandemics, maybe. The authors detected ARI virus, respiratory pathogens, in wastewater. And this is the top row, and they looked into human coronavirus. These are the epidemic coronavirus. They are called HCOV OC43 2029 or 229 or 229E and so on. They are well known since the 1960s. And you see here over time, they are detected with a varying frequency, and so are the human para-influenza virus 1, 2, 3, and 4. This is the detection rate in wastewater. In the line below, what you see is the detection of these respective pathogens from surveillance laboratories. And this, as you can nicely see, this goes very nice in parallel. This allows public health officials to monitor respiratory pathogens in wastewater. And the advantage of this type of testing is it is quick and cheap, comparatively cheap. You don't need to test hundreds of patients to see what's going on. And usually you get a negative result, by the way, but you specifically look against pathogens, you look in wastewater, and you get results basically within a day. So this is a nice tool for the next pandemic, ARI-pandemic to come. And COVID, Melvin, any suggestions from your side, any views?
This was something that was done in New York. I think in 2021 or 2022, they've been doing this to sort of help them with the planning. And I think it's quite helpful because you will definitely see a correlation between the number of all these viruses you detect in the wastewater,
Yeah.
and a potential for an outbreak.
Yeah. Yeah, and actually, many people picked this up from previous studies elsewhere, and that was done in many places around the globe, including Germany, I remember. And you may also remember the polio detection in wastewater, right? The polio virus and the vaccine-derived polio virus were identified in wastewater. And I guess this is a tool in the future, and wastewater may be quite useful in the future for epidemiology of infectious diseases. Mm-hmm. Finally, I have a new item here, which I call fake news, fake product. And I apologize, it is in German, but it is very difficult for me to translate it word by word and to write it down even. So I translate a little bit. What this is it is called Zecki. The translation would be ticky or little tick. And it is a homeopathic product. They take a tick, actually, they say it's a tick 2022. They don't say which type of tick it is. There are several tick species, right? Ixodes ricinus and many, many others. So they take any tick from 2022, and the homeopathic preparation usually includes log-fold dilutions, so that in the end, nothing of the tick is left. And the basic product that is shown here is water. And I'm not sure you can believe that there is some molecules of the tick, or the idea of the tick, or the spirit of the tick may be in here, but there is nothing that would work in a scientific in a scientific way. They speak of natural energetic protection against ticks. And why should you get protected against ticks? It says they want to prevent that you're sucked out. Now, in the end, a tick may be able to suck one drop of blood from your 5-6 liters of blood that you have, which I don't see a problem. The problem is really if ticks transmit diseases. And there is no pathogen here, neither in a homeopathic doses nor in any other way. So there is no way that this can protect against anything. And if you look at the wording, it is all unbelievable. It is totally unscientific, and you have to believe in the whole construction of homeopathy to believe in the terms. But from a scientific point of view, this is totally nonsense at a price tag of 29 euros for 50 ml. In comparison, a dose of TBE vaccine in Germany is roughly 60 euros. You need 3 of them, which is 180 euros. So with less than 4 of these that are not working, you could buy good protection against tick-borne encephalitis, which is a severe disease, whereas ticks don't really bother you very much unless you have an infection. And there is no claim in here that this may protect against any of the diseases that are transmitted by ticks. Melvin, any views on this one?
I think for me, it's just difficult to reconcile the fact that products like this are very popular in Germany and Switzerland. And for me, at least, my view is that Germany and Switzerland are two countries that are very into detail, into data, into information, and basically these products don't have those things, and they're just accepted, you know.
Yeah.
So yeah.
Yeah, it is hard for me to understand, but maybe what is also in the tradition is this, and actually it is in southern Germany, Baden-Württemberg and Switzerland, they are neighbors, right? So this philosophy has existed there for more than a century, and this is why it is still in the brain of people. And it is really, from a scientific point of view, how can people believe in this stupid stuff, right? How can they even spend money on this? But what can you do?
And the same people who are actually believing in this kind of stuff, they're the same people who demand all the information from the vaccines.
Yeah. At the same time, they want real data on real products that are licensed and have shown efficacy. Yeah. Yeah. I mean, here the whole concept is wrong. To prevent tick bite is certainly nice, but you cannot do it with plain water, right? It is stupid. And the concept that you dilute a tick billion fold, and then there may be something that protects you against a tick bite is just, I'm not sure what it is. It's fantasy, right? It is fake news. And this is a fake product. Melvin, you have a last point on TB.
Yep. Yes. So I chose this as our ending slide just to remind people that we can actually end TB, but we need to track the progress. We need to develop and implement new tools. We need to support this whole effort. We need to test and treat those who have latent TB infection. And people need to share their stories because people need to understand that TB is curable, TB is treatable. And of course, we need to fight TB locally and globally because as long as TB is a problem anywhere in the world, we are all at risk.
Very nice summary slide on TBE. And this brings us the end of our Global Healthcast today. And to summarize, we brought you the COVID-19 update with numbers and deaths declining, the flu update with declining cases and flu B emerging or still there in some areas of the world. We spoke about the World TB Day and tuberculosis efforts for eradication. I spoke about acute effects of caffeine, persistence of yellow fever, neutralizing antibodies, safety of mRNA vaccines, wastewater to detect ARI-pathogens, and finally we spoke about fake products for prevention of ticks. Melvin, thank you very much for joining us today. Everybody, thank you for joining us today. Melvin, any last word?
No, thank you very much. And still, COVID is out there, so still do everything that you can to protect yourself from COVID, because the best thing to do to prevent yourself from having all these issues and long COVID is not to get infected in the first place.
Thank you very much. Goodbye, and hope to see you next week. Bye-bye.
Bye.